Hello everyone, my name is Akang Shrinani, and welcome to my YouTube channel NeuroChat with AG. On this channel, I plan to cover topics that are closest to my heart and support the neurodiverse community. Topics related to neurodiversity, autism spectrum disorder, and more. On the channel, I will interview thought leaders, esteemed researchers, scientists, professors, doctors, and psychologists, seeking their views and updates on their latest work, research, etc. I will also chat with parents of neurodiverse kids and adults and talk about experiences of neurodiverse individuals. Dr. Lawrence Fung is an associate professor at the Department of Psychiatry and Behavioral Sciences at Stanford University. He is the director of the Stanford Neurodiversity Project, director of the Neurodiversity Clinic, and principal investigator at the Fung Lab. His work, which focuses on autism and neurodiversity, traverses from multimodal neuroimaging studies to a new conceptualization of neurodiversity and its application to clinical, educational, and employment settings. His lab advances the understanding of neural bases of human socio-communicative and cognitive functions by using novel neuroimaging and bioanalytical technologies. Using a community-based participatory research approach, his team devises and implements novel interventions to improve the lives of neurodiverse individuals by maximizing their potential and productivity. His work has been supported by various agencies, including the National Institutes of Health, Autism Speaks, California Department of Developmental Services, California Department of Rehabilitation, and Philanthropy. He received his PhD in chemical engineering from Cornell University and his medical degree from George Washington University. He completed his general psychiatry residency, child and adolescent psychiatry fellowship, and postdoctoral research fellowship at Stanford. Doctor, welcome, and thank you very much for the time today.
Thank you so much for having me, Akansh.
So, rarely in life, you get a chance to interview your teachers, and I am so lucky to have studied under you at the Stanford Neurodiversity Project, Research, Education, and Advocacy Camp for High Schoolers, S&P Reach. For our audiences, can you share some highlights of your career and any pivotal moments that shaped your research direction?
Yeah, I have been in the field of autism about 15 years or so. And in the beginning, the reason why I got into the field of autism is because of my son's diagnosis. He got diagnosed with autism about 16 years ago. And since then, I've been focusing on autism for my clinical work as well as my research and any community-related work and other educational activities that I organize. And after a few years, when I started just about 10, 15 years ago, at that time, all that was offered to autistic individuals are primarily using the medical model, which is to help people by fixing any problems that providers identify. And this is a deficit-based approach, and I see my son growing up, and I see that he has tremendous strengths, and I see that he will have a better trajectory and a positive identity about himself if he values his own strengths and other people also value his strengths. So at that point, basically, I was starting to conceptualize a strength-based model, and I later on call it strength-based model of neurodiversity, and started doing research that are around that.
Thank you. Your story is very inspiring, and thank you for sharing that. And could you tell us a bit more about the Stanford Neurodiversity Project?
Yeah, the Stanford Neurodiversity Project is a special initiative of the psychiatry department. It is it was found about 7 years ago, And the precursor of that was the special interest group of neurodiversity. And I mentioned to you that in the beginning, when I was doing research related to autism, all we know what to do was a deficit-based approach. And the special interest group was basically to have an attempt to really learn about neurodiversity and a different way of reconceptualizing neurodiverse conditions such as autism, and especially to try to bring in a strength-based approach. So basically, at that point, we were holding monthly meetings that we have still been holding currently. So from there on, we were getting a lot more interest, and we also gained traction, and we got some funding from philanthropy, from various agencies, and started to do different things that are related to employment, education, and mental health. And basically, right now we have the full-fledged programs within the Stanford Neurodiversity Project, and one of them is SMP Reach, which is a summer camp that you attended, Akansh, and you graduated yesterday from that camp. Basically, that's a 2 weeks immersive summer camp focusing on neurodiversity, and the campers focus on understanding neurodiversity, design thinking, as well as universal design, and develop very meaningful neurodiversity advocacy project within 2 weeks. So there's one educational program that we have offered for the last 5-6 years. And I also teach a course at Stanford on neurodiversity. We also have other educational workshops that offered to different communities. And we also have employment program. We have a program that have allowed us to create several curricula that are supporting people on the autism spectrum in terms of employment. And in parallel, we also help the employers, the other stakeholders in the employment setting, to get them to be more able to make the workplace more neurodiversity friendly. So, so basically, we have been doing a lot of these year-long programs and studies, and we also have a Stanford Neurodiversity Summit. It's a conference that we have run for 4 years already. This year is going to be the 5th one. We have 3 days of conference that cover a lot of different topics, from employment to K through 12 education, higher education, mental health, and human rights. So every year we have been attracting thousands of people to join us virtually. This year is our first year that we are going to be having the in-person component. So it's going to be a hybrid conference, and it's going to be from September 22nd to 24th. So some of your listeners and viewers may be interested in joining us either in person or at Stanford or virtually.
Thank you. And if you could explain how you define neurodiversity and why it's important to understanding autism?
Neurodiversity is defined as a concept that regards differences in our brain and also behaviors as part of normal variation of the human population. And it is important to highlight that there are different traits that people have, and neurodiverse individuals, a lot of the time, they can have really significant strains in some areas, and it is also common that they may be struggling in other areas. And it is not too different from other people that are considered to be neurotypical. We all have strains and challenges. So, but this basically tells us about, for all people, especially neurodiverse individuals, there is also this consideration of tremendous strains that can be utilized by the society. And if the society is thinking about neurodiversity and neurodiverse conditions as something that can actually help organizations and society at large, then there are a lot of potential important consequences that may follow. Is not uncommon that people on the autism spectrum, which is one of the neurodiverse conditions, to receive benefits from the government. And the government has been really spending billions of dollars to support people on the spectrum and with other developmental conditions. And a lot of the time, they are not working as well. The individuals on the spectrum, 80% of people on the spectrum are unemployed or underemployed. However, if we are more able to understand the strains of neurodiverse individuals and more able to develop their strengths and interests so that it can be helpful for the workplace, then potentially they are going to be benefiting from not only getting this positive identity about themselves as a worker, as they also contribute to organizations and the society. And the potential could be that they can actually earn a living themselves instead of getting benefits from the government. So the consequence can be really remarkable, and the potential for the shifts economically for the society is huge.
Thank you for explaining that. And how has your understanding of autism evolved since you first began your research? And what key experiences or discoveries contributed to this evolution?
It was really when my son's growing up, when I really believe that a strength-based approach is going to be helping him and other people like him. If we are using a deficit-based approach, there is going to be basically a lot of gaps and voids, and would not really help people on the spectrum and with other developmental conditions to focus on how to develop their strengths and interests. So basically, from there on, I was using the strength-based model of neurodiversity, which include several key components that are really very mature concepts that we are using in science and in clinical practice, and that include positive psychology, positive psychiatry, Chickering's 7 factors of development, and Gardner's theory of multiple intelligence. So using all of those key components, we built the programs that I talked about a moment ago, and basically we are doing research to understand whether what we believe is really true. We want to generate the evidence base of it, and also try to understand in a deeper fashion, what is the science behind it?
In your view, what are the most critical misconceptions about autism and neurodiversity that still persist in both the scientific community and the public? And how does your research aim to address these misconceptions?
Yeah, so the biggest misconception for people on the autism spectrum is that, first of all, if you have met one person on the autism spectrum, you have really met one person on the autism spectrum. There is a really wide range of presentations. I've met people on the spectrum that have 160 IQ and a really, really superior intelligence in terms of mathematics and sciences, to nonverbal individuals that have a lot of substantial needs. And when you're thinking about the two extremes, a lot of the time you may be thinking that the first person that I talked about must have no issues, and the other end would have a lot of issues. But the truth is that different presentations, they have their own needs. They have their own struggles. They have also their own strengths. People that are non-speaking, for example, they actually can have high intelligence if they are tested properly. But the problem for the typical IQ tests and other assessment tests is that when you're not speaking, you basically are deemed to be tested almost over 99% chance you would be tested with a low score. Not because you cannot actually figure out the answer, it's because the test environment and the setting would not allow the individual to be showing their strengths. So basically, the misconception is that people use their perception about people in general with first impressions and decide that that's autism, and also decide that the trajectory of those people are going to be really bad if someone is not speaking, and someone that has 160 IQ will have a very good trajectory. Someone with IQ of 160 may have a lot of advantages. However, a lot of the people on the autism spectrum that are high IQ, they also suffer tremendous anxiety and tremendous social interaction challenges. And a lot of the time, they have trouble with finding work, despite their seemingly obvious advantage of high intelligence. So basically, that's the message about the misconception. Most people in the scientific community and the public use a stereotype or a very few set of stereotype to understand what people need in the autism community, and a lot of those can be wrong. They can be really not helpful for people on the spectrum. And one other example is that because in the healthcare system in the United States right now, applied behavioral analysis (ABA) is almost always covered by insurance, and because of that, the ABA is offered to everyone that has the autism diagnosis. And I have to say that it's not for everyone. there may be some people that can benefit from ABA, but it's not everyone. So it is important for the general public to understand that. And how does the research that I'm doing aim to address these misconceptions? So basically, some of the research that we are doing involve psychoeducational interventions that basically try to uh, educate the public on the misconceptions that I talked about. And if we are able to use those psychoeducational interventions um, at many levels, for example, in the clinical setting, it will be the psychologists, the psychiatrists, maybe other clinical providers. In the research setting, it will be the scientists, and also in the educational setting will be the teachers as well as the parents. So basically, we have different tools that are now developed that are aiming for addressing to the misconceptions using these psychoeducational curricula.
And your research emphasizes the neurodiversity paradigm. Can you discuss how this perspective has changed the approach to both research and clinical practice in autism?
Yeah, so one of the main things about research and clinical practice in autism, as I mentioned, is that for the longest time, since 80 years ago, 80 years ago, uh, that's when Leo Kanner, who coined the term autism and described the first 10 cases, 11 cases of children on the autism spectrum. So it is exactly 80 years now. And so far, uh, the DSM, basically the Diagnostic Statistical Manual, or that's basically the Bible in psychiatry. That's the psychiatric classification system that we are using. So basically, since Leo Kanner started, and then later on, the DSM is used to describe what autism as a diagnosis is and what are the criteria that will describe autism. All of those has been primarily deficit-based. So everything is about a deficit, and there is really not much, if at all, talking about the streams of people on the autism spectrum. And actually, to backtrack a little bit, is that Leo Kanner, in the very beginning, did describe some of the streams of people on the autism spectrum in those 11 cases. And then Hans Asperger, the next year in 1945, also had described that the strains of people on the autism spectrum. But afterwards, it's all going in the direction of deficit-based model. So the main thing that we would want to change in the neurodiversity paradigm in both research and clinical settings would be to really identify the characteristics of autism as characteristics instead of deficits. So an example for that is that people on the spectrum, sometimes they do things over and over again. And some people would describe that as perseveration. But when you're seeing good results from the activity, then you may actually describe it and say this is really a result of persistence. or even perseverance. So all of a sudden, the deficit can become strength. And the other example is that people on the spectrum tend to be drawn to details instead of the big picture. In the psychiatrist's point of view, for the most part, when they see that, they think that it's a deficit, but it is really highly contextual. When someone on the autism spectrum is trying to solve a problem that require details, like debugging a program, you would want that person to be focusing on the details. Otherwise, the program will never be debugged. So all of a sudden, that characteristic of autism becomes a strength instead of a deficit. So not seeing the big picture, or the tendency of not seeing the big picture, will not be a weakness or a deficit all the time. So there are many of these examples about autism, and also with other neurodiverse conditions like ADHD, that we can really use more of a holistic approach to understand the characteristic and know that there are two sides of the coin, both strengths and challenges.
And could you delve into the specific neurobiological mechanisms that your research has identified as being crucial in understanding the diverse presentations of autism?
Yeah, so the neuroimaging studies that I had conducted, primarily, that's really giving us a good sense on the gender differences in the neurobiology of autism. It is somewhat different from the neurodiversity paradigm that we have talked so far. In the scientific community, at least in the past few years, the opening of the opportunity to study the neurobiological mechanisms of neurodiversity is not really that much. So basically, my scientific pursuit on the neurobiology has been really trying to focus on what are the key factors that can be helpful to understand the broad spectrum of presentations of autism. So one of the main things is about the gender differences. For some of your viewers, the male to female ratio of autism diagnosis in the United States is 4-1. So 4 males and 1 female. So why is there such a difference? Is there differences in the brain circuitry between males and females on the autism spectrum? So basically, what we have done in the last few years, since 2016, so the 8 years or so, we have done a series of studies that have shown that the males and females on the spectrum have different neurobiological mechanisms. And we have studied the excitation inhibition theory, and primarily understanding the inhibition side of the brain. So just like your car, if you need to go somewhere, you need to have the car accelerator and the brake to work. So basically, we're trying to study the brake. And basically, what we have seen is that the function, the correlation between the social interaction function and autism characteristic have a positive correlation to the neurotransmitter for inhibition GABA, but they are in two different directions between males and females. One is negative correlation, the other is positive correlation. So basically, the more challenges in social interactions in males, we are seeing that for those individuals, they have less of that neurotransmitter in their brain, especially in the place called the thalamus, which is a brain structure that's responsible for filtering of senses. So basically, in females, on the other hand, the correlation is negative. So the more challenges in the social interactions and the autism characteristics, the higher GABA concentration that we are seeing. So these kind of gender-specific differences have been shown not only in the neurotransmitter concentration, we also have found the similar kind of differences in the findings, in the correlations with other biological markers, including functional activity, functional connectivity of specific regions, as well as the cortical thickness, the thickness of a particular part of the brain on the surface of the brain. So, those are the things that we have been looking at, and we would hope that we can gradually get us to understand more of the neurobiological mechanisms using a more of a strength-based approach as well in the future.
That's really interesting, the research that's been going on. And this was one of the biggest things I learned that like I had no idea about, and it really establishes what the problem is in your lecture. So what are some of the barriers that keep neurodiverse individuals from accessing mental health resources?
There are many layers of barriers. So one huge barrier is that there is a lack of mental health providers that are specialized in autism. And I spent many minutes in my lecture talking about the training aspect in the medical system. Basically would not the current medical education system really make us very difficult to have a lot of or enough not nearly enough mental health providers that can serve neurodiverse individuals. So education is one, and then the other part is the medical system in terms of geography. The different places in the United States have different densities of mental health providers. And in some places, there are very, very few mental health providers, period. Not to say that there is a lack of mental health providers that are specialized in autism or with other neurodiverse individuals, neurodiverse conditions. And the other thing also is on the side of the neurodiverse individuals. A lot of neurodiverse individuals do not seek care because of they don't know how to access the healthcare system. But even if they actually can have access and they know how to access, they may decide not to because of the stigma. And this topic basically can there's a lot of details that we can talk about it, and we can talk for another hour on this. But basically those are the main barriers. And it's not only at one level of challenge, it is very systemic in the medical system, in the medical education system, and at the individual level. And you can also say at the family level as well, because sometimes there are some families that have influence on the neurodiverse individuals, and because of the stigma, they don't seek care.
So, how do you integrate the latest advancements in neuroimaging and genetic analysis into your research? What unique insights have these tools provided?
Yeah, so for me, I have been using more of a neuroimaging methodology. The other kinds of advances in scientific tools is also the big data. So basically, there's a lot more uh, data that's captured by like cell phones and a lot of the different communication tools in our society, and there is more and more data that are actually captured, and they are actually in the World Wide Web already, and there's a lot of stuff that can be mined that can uh, be used to study social behavior. And basically, artificial intelligence is also another part that is a big advancement in terms of the tools that are available. So what I can say is that the traditional neuroimaging and genetic tools are definitely still very important on the kind of the detail individual level. We need that kind of data, but the more population level data with what I just talked about can also be very uh, they can bring breakthroughs for different reasons, and that's not something that we were able to imagine even a few years ago.
And looking ahead, what do you believe will be the next major paradigm shift in autism research? And how are you preparing to contribute to or adapt to this shift?
Well, I can only say that I believe that a big paradigm shift in autism research will be to use the strength-based approach and also a community-based participatory research approach. Our group has been doing research basically with a lot of community input. So that's very different from the research that most scientists do in the last 100 years. Usually, scientific research is done on the basis of observations that are made by scientists, and scientists make hypotheses based on the observations, and then they prove it, and they try to make all the decisions within the research team. But what I just talked about with the community-based participatory research is about getting the community stakeholders like autistic individuals and their families to craft the questions for research and be participating in every step of the research planning and the execution process.
And I'm curious, are there any emerging technologies or methodologies in neuroscience that you find particularly promising for autism research?
Yeah, I think I kind of talked about the 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 big data could be helping with understanding behavior, and the artificial intelligence can help us analyze data that is not like anything that we have done before. But to really understand brain science, you actually have to study the brain. So some of the biggest breakthroughs actually has been happening at Stanford, and Karl Deiserov in our department has uh, invented the tool of optogenetics. So that's one of the biggest technology breakthrough in our generation. And there's also Sergio Pasca also in our department that has grown um, uh, little brains. So that's a very very promising angle of trying to understand brain circuitry uh, using very sophisticated methodology that can uh, that can get us to answer questions that we could not answer in the past.
In terms of public engagement and education, what role do you see that having in advancing the understanding and acceptance of neurodiversity, and how how do you actively participate in these efforts?
Yeah, so um, public engagement in education, definitely what is most important is to figure out what's the audience that will be most needed to be educated. So basically, what our group has been doing in various different settings is that on one hand, we focus on specific groups of individuals like employers. We need them to know uh, about the neurodiversity perspective, and that will be helpful for their DEI or diversity, equity, inclusion initiatives. We also have targeted like educators, both in K through 12 as well as in the higher education setting. And medical providers, I give talks to many departments of medical schools around the country. So that's kind of part of the effort. The Just like SNP Reach, for example, educating the next generation of leaders, the young people that are passionate about neurodiversity, and give the tools for the next generation, so that they can continue on the work. So the more general kind of public engagement would be the Stanford Neurodiversity Summit. So we have run that for 4 years. This year is the 5th year. So I mentioned that we have the hybrid conference this year. So that's how we are engaging with the public in the last few years.
Yeah, and I'm sure it's been a very big impact in terms of the community. So, if you could convey one core message to policymakers, educators, and the general public about autism and neurodiversity, what would it be and why?
I want to tell policymakers, educators, and general public that neurodiverse individuals are really among you already, and they are already making tremendous contributions to the society. Many things that are really paradigm shift that have led paradigm shifts were actually invented by neurodiverse people. And thinking about understanding neurodiversity as another wave of trying to get our society to be more able to utilize everyone's strengths is the biggest message. And the reason for that is that when we are able to get neurodiverse individuals to be contributing to society instead of getting them to only be sitting at home and not contributing, you can appreciate very easily the stark difference. And this is not only good for them to come out, it is good for the society.
What advice would you give to young researchers or students interested in pursuing a career in autism research or neurodiversity studies?
If they are interested in pursuing a career in research or neurodiversity studies, feel free to talk to me. I would love to figure out if there are opportunities or if I know of any good opportunities to help young people to pursue their interests in that are related to neurodiversity. I would be happy to do that. And my advice is that it is important to find people that are truly wanting to contribute to the field because of neurodiverse individuals' strengths, and not because this is like something that is like a social justice. You're trying to only doing the research because you think that this is about inclusion. This is also about understanding human potential. So I think if you can find places that have that environment that can allow students to try to understand how neurodiverse individuals' potential can be maximized, I think that will be a good environment.
Thank you. Is there anything else you'd like to mention?
I just want to tell all the young people that are listening to this podcast, you are the leaders of the next generation, and you can really make this world better by embracing the neurodiversity paradigm.
Dr. Fung, thank you so much for this wonderful conversation and all your amazing success so far, and I hope for more for you. Thank you so much.
Thank you, Akash.